Hello guys and welcome back. This is the part 2 of a series of videos I'm going to do about the minimum dataset you need to obtain in order to perform an echocardiogram. In this video, I'm going to show you all the minimum dataset you need to obtain for the right ventricular inflow and outflow views. Thank you for watching. Don't forget to like this video and to subscribe to my channel. So let's start. Let's start with the right ventricular inflow view. First, obtain a right ventricular inflow view and perform a visual assessment of the cardiac chambers. Pay attention to the right ventricle and the right atrium. Then, do a visual assessment of the tricuspid valve anatomy. Next, do a visual assessment of the wall motion. Check the right ventricular anterior wall motion and the right ventricular inferior wall motion. Also, assess the coronary sinus and do a visual assessment of the inferior vena cava. Now in the same view, the right ventricular inflow view, using color Doppler, perform a tricuspid valve color flow assessment. First, do a visual assessment, checking the tricuspid regurgitation density and contour of signal, measured by the continuous wave Doppler across the tricuspid valve. Here you can assess the tricuspid regurgitation. Measure the peak tricuspid regurgitation velocity with continuous wave Doppler across the tricuspid valve. Now let's move to the right ventricular outflow view and all the minimum dataset you need to obtain when you get to this point. First, obtain a right ventricular outflow view and do a visual assessment of the right ventricular outflow tract. Next, visually assess the pulmonary valve anatomy and also check the main pulmonary artery and the pulmonary artery branches. As part of the quantitative assessment, you can measure here the main pulmonary artery diameter. Now use color Doppler to visually assess the flow across the pulmonary valve. Using continuous wave Doppler across the pulmonary valve, you can assess the pulmonary valve forward flow. Just measure the peak pulmonary valve forward flow velocity. After analyzing the forward flow, now you can do a visual assessment of the pulmonary regurgitation. Check the pulmonary regurgitation density and contour of signal. This is measured by the continuous wave Doppler across the pulmonary valve. Now I'm going to show you a few measurements you can perform in order to assess the pulmonary regurgitation. If you have a good trace, you can measure the pulmonary regurgitation peak velocity, in the same view, you can measure the pulmonary regurgitation end of diastolic velocity, and also measure the pulmonary regurgitation pressure half time. All this is measured by continuous wave Doppler across the pulmonary valve. Now, if you want to and if you need to, you can assess the right ventricular outflow tract in this view. Using pulse wave Doppler at the right ventricular outflow tract, you can measure the pulmonary velocity acceleration time. And to finish, if you need to, because it's not mandatory, you could measure here the right ventricular outflow tract VTI. This is also measured by pulse wave Doppler at the right ventricular outflow tract. Now I'm going to show you on a video, once again, all the minimum data set you need to obtain in order to perform an echocardiogram. In this part 2, we are focusing on the right ventricular inflow and outflow view. First, visually assess the cardiac chambers, the tricuspid valve, the coronary sinus, and the inferior vena cava. After the 2D assessment, use color Doppler to visually assess the blood flow across the tricuspid valve. Now, with continuous wave Doppler, visually assess the jet density and contour and measure the peak velocity of the tricuspid regurgitation. Let's continue with the right ventricular outflow view and do a visual assessment of the pulmonary artery, pulmonary valve, and the right ventricular outflow tract. Use color Doppler to visually assess the blood flow across the pulmonary valve. Next, assess the forward flow using continuous wave Doppler and measure the peak velocity of the pulmonary valve. Then, you can assess the regurgitation. Measure the peak velocity of the pulmonary regurgitation. Also, you could measure the pulmonary regurgitation end of diastolic velocity and measure the pulmonary regurgitation PHT or pressure half time. All these using continuous wave Doppler. Now, using pulse wave Doppler at the right ventricular outflow tract, you can obtain the pulmonary velocity acceleration time, and also you can measure the right ventricular outflow tract VTI. Thank you for watching, and don't forget to like this video and to subscribe to my channel. Bye!